Hi everyone, welcome to Fits on the Go at ACC 25 in Chicago. My name is Amanpreet Singh Wasir and I'm representing the ACC Medical Students Members Community. It is my distinct pleasure to introduce to you Dr. Giulia Magnani from the University di Parma from Italy. Thank you so much, Dr. Magnani, for taking out the time to speak with us.
Thank you for having me.
Congratulations on the ALLEPRE trial, which was presented as an LBCT today. And I think I'll go straight towards the questions. This was a trial which really stood out in being very different from the classical ones we really think about, because it was a nurse-led trial and there was an integrative program involved. So what was the rationale behind having a program for nurses implicating in secondary prevention for ACS?
So thank you so much for this question. As you know, acute coronary syndrome is the main contributor to the burden of cardiovascular disease, both in terms of mortality and morbidity. And we know that pharmacotherapy, cardiovascular risk factors control, and lifestyle modification improve outcomes. However, there is a huge gap in real world, and secondary cardiovascular prevention is poor. And there are some results in recent years from trial conducted by nurses with cardiovascular prevention program. However, these programs are heterogeneous in terms of the programs, and also they rely on short-term outcomes. So what it was missing, it was a trial with hard outcomes and a long-term follow-up. And therefore, we designed the Alliance for Secondary Cardiovascular Prevention after an acute coronary syndrome. That is a trial about a fully nurse-coordinated cardiovascular prevention program. And the objective was to evaluate whether the nurse-coordinated prevention program was effective in terms of MACE reduction, so hard outcome, cardiovascular death, myocardial infarction, and stroke, compared to standard of care in ACS patients.
Perfect. Thank you so much. And I think this was really necessary to have the nurses as an integral part of the preventive team to really help in the secondary prevention post ACS. And this makes me think about the second question, which is a follow-up on the trial and the methodology behind the integrative program, which is that now with the trial being published and all of us being aware of the ALLEPRE trial and the integrative program for nurses, how do you see the clinical implications in terms of integrating this program towards secondary prevention now going forwards from here?
So thank you so much also for this question. I think that this trial has a very important point. So before to provide the nurse coordinator prevention program, there was a training phase. So the nurses were in person, centrally trained. They were nurses working at the participating hospital, cardiology nurses, and they were trained by a multidisciplinary team of physicians, nurses, and psychologists. And we are very proud to say that we train more than 250 nurses that at the end of the training were awarded with a certificate in cardiovascular prevention. So the training is replicable also in other settings. And then there was the part of the nurse coordinated prevention program. So the nurse provided a patient-centered counseling about cardiovascular risk factor control, lifestyle modification, and of course check medication adherence. And it's interesting that we found that the nurse was effective in changing behaviors, which is the hardest part for us as cardiologists.
Right. I totally agree with that. I think behavioral prevention and non-traditional risk factors is something which I was very happy to see being focused towards in the nurse integrative program. No, that's great. I feel that now with the trial being published, people will be more aware of how to prevent using nurses as an integral part of the team. And just a last question, and what would be that one take-home message that you would like to give to resource-limited healthcare places and institutions in order to implement these strategies in their own institutions?
This is a very good question, because the number of ICS patients is increases because we are good in taking care of them, and also because of the aging of the population. So this trial is teaching that a task shifting from physician to nurses of the cardiovascular risk assessment is not only possible but also very efficient, because we had a reduction in MACE. And what I personally think is that the nurse is ideally positioned to interact with the patients, because we have to think that usually the nurse is the first point of contact with the patients, with the caregivers, and therefore an ideal position also to care the transition from in-hospital to the out-hospital settings. And also I would like to stress that in our trial we included both larger hospital provided with a cath lab, with a cardiosurgery unit, but also a smaller hospital. So the program is feasible in different healthcare settings.
That's great, and thank you so much. I mean, we're looking forward to how the impact is going to go global, and people will be more aware of integrating nurses in the secondary prevention.
Thank you so much.
Thank you so much. And for more interviews like this, please log on to youtube.com/FITsOnTheGo, and we look forward to seeing you at the next convention. Thank you.